Thank you for joining us here on Mirror Now. Our top focus: the National Medical Commission has backed down under the intense protest by the doctors. The NMC has taken back its new regulation, which made it mandatory for the doctors to only prescribe generic drugs, else they risked losing their license. Now, earlier, the IMA delegation met Union Health Minister Mansukh Mandavia, demanding a rollback on the new notification. Reports indicate that the government asked the NMC to withdraw the particular clause of the notification which dealt with the penalties, acknowledging the doctor's concerns that generic drugs can't be prescribed in all cases. To discuss more on this, let me introduce our panel. Joining us at this point in time, Dr. Ishwar Gilada, Secretary General for the Organized Medicine Academic Guild OMAG, and Dr. Sanjeev Pagai, on the other hand, the chairperson of NEFRON, and Dr. Sanjay Kumar Pandey, the National Secretary, the Indian Association of Physical Medicine and Rehabilitation. Thank you, doctors, for joining us here on Mirror Now. Let me go across to Dr. Ishwar Gilada first. Dr. Gilada, the orders that were issued by the National Medical Commission, which had barred doctors from prescribing the medicines other than the generic drugs, has now been put on hold with immediate effect. What does this mean, and why has this been done? Dr. Gilada, we are unable to hear you, sir. You need to unmute yourself.
Yeah, I have unmuted already. Can you hear me now? Okay.
Right. Right.
Can you hear me now?
Yes.
Hello?
Yes, doctor. Please go ahead.
Hello? Can you hear me now? Hello?
Yes, doctor. Please go ahead.
Hello? Hello?
All right. Dr. Gilada, we will come back and check your audio there. We are, of course, being able to hear you, sir. We'll come back and fix that audio. All right. Dr. Gilada, if my voice is reaching to you, sir, please go ahead with your thoughts.
Basically, it was wrong on the part of the National Medical Council to issue such kind of circular. We doctors are aware that we should use generic. For the viewers, they should understand one thing. There is one patented drugs which are mostly international drugs, and we have generic which are already branded and generic. Now, suppose for example, I have to write a paracetamol. If I don't write
All right. Dr. Ishwar Gilada, we are facing a connection issue there with you, sir. Let me go across to Dr. Sanjeev Bagai joining us. Dr. Bagai, what is your take at this step that has been taken by the NMC now, that has, put a hold, as it had earlier barred the doctors from prescribing the medicines other than the generic drugs only?
Good afternoon. So I think the basic aim of NMC was to give, and it is to give quality healthcare, which is standardized, of a good quality, affordable and accessible in terms of the doctor's availability to all patients of all strata of society. When you come to the word generic drugs, it means basically the name of the salt and not the brand which is launching it. So I think the generic drugs per se are more cost effective. But I put a rider here. The ethos was to make it more cost effective, but the rider really is that the generic drugs have to be of a particular quality, a minimum level of safety, the drug composition and the constituent and the concentration of the drugs, either in a syrup or in drops or in tablets or injectables, have to be the same of any other drug of the same type, with the same bioavailability, same strength, and with no adverse reaction. So I think overall, if you look at it, it could have been more balanced. I think it's important that the doctors have the ultimate jurisdiction and the choice to use a particular line of medication. Yes, the generic drugs are more cost effective, but I would also like to add that there is a huge variation of the same drug amongst different multinationals which are available in the Indian market. So I think that needs a better framework so that the price range and the bandwidth is more affordable for patients. if you look at it from a clinical point of view, a routine patient who comes in, not counting the cost of consultation, just an oral antibiotic and antipyretic fever medicine and an antitussive cough medicine would cost an adult or an adolescent anywhere in the range of 1,000 to 1,200 and up, as far as the cost of a 5 to 7 day validity prescription is concerned. So I think we need to keep a watch on the total cost, because most of these expenses are out of pocket and they're often not covered even if you're insured through a national or an international multinational insurance company. So I think we need a balanced approach in this. The ultimate aim is to give quality healthcare to patients, which is truly affordable. Over to you.
Right. Doctor, stay on with us. Let me go across to Dr. Sanjay Pandey, who's also joining us on the broadcast. Dr. Pandey, what is your take now on this particular information that we are gathering, that there has been a hold that has been put immediately on the NMC order that had barred doctors from, of course, prescribing the medicines other than the generic drugs as well? And also, I would like you to comment on the alleged diktat now by the NMC, because the National Medical Commission has removed 3 departments from the list of the essential departments for medical colleges that has been causing tensions with the doctors.
Yeah, thank you. First of all, I'd like to congratulate Times Mirror now for bringing this issue. And at the same time, I would like to say, basically, this National Medical Commission, this government regulatory body, has been entrusted with the responsibility of the medical practice, medical ethics, and medical education in our country. And as far as this generic versus branded medicine is concerned, our Indian Medical Association has taken it very seriously. And thanks to our Prime Minister and our Honorable Health Minister, they have kept this NMC order on abeyance till further discussion with IMA and other authoritative body. Now, coming to the very vital thing that is going to affect the medical education in our country, that is the NMC in its own guideline made all 3 subjects mandatory for any institution who are going to start this MBBS in their institute. This is the physical medicine and rehabilitation, the respiratory medicine, and the emergency medicine. Now, ma'am, I would like to emphasize our specialty, that is physical medicine and rehabilitation. This is the only medical specialty which cater to the need of people suffering from disability. And as we can remember and we can recall, our own Honorable Prime Minister, Sri Narendra Modi ji, coined the term Divyangjan to give the dignity, to give the moral and ethical value to the problem of disability. And even our Modi ji started this Accessible India campaign for the Divyangjan. Now I am failed to understand, in fact, very appalled to see the recent guideline issued by the NMC for this undergraduate competency-based medical education. They have removed this physical medicine and rehabilitation, because you understand the people suffering from disability, from children to adult, the pediatric to geriatric, the people from muscular dystrophy, the children with muscular dystrophy, cerebral palsy, a spinal cord injury patient, a sports injury patient. It's our specialty which cater to the need of these patients. Now, you just assume an undergraduate, MBBS graduate who is taking education in a medical college, which don't have physical medicine and rehabilitation department. He will not able to even prescribe the auxiliary crutch. Apart from, forget about the wheelchair and other prosthetic and orthotics, even disability etiquettes, that were in the curriculum of NMC itself. And now they have removed our specialty. So I am very much concerned about the future of our medical graduate, upcoming medical graduates, how they will be trained, how they will be teached to deal with the problem of disability, because 2.1% of our population are suffering from disability. And this is the only discipline, and considering and giving it importance, they made it mandatory. And now they have removed. So I am urging our Honorable President and our Honorable Health Minister, sir, please give it a thought. And I'm also requesting authority of the NMC revise their decision and have a discussion with us if needed. We are ready to discuss the issue with you, but don't remove these all 3 subjects. Even respiratory medicine during the COVID pandemic, we all know how much they have contributed for the safeguard, for the health, and for the life of our countryman, the emergency medicine, very much needed. It's a question of life and death for a patient when they reach any medical college. So these all three departments need not be removed from the list of mandatory department. Otherwise, the institution don't have any obligation, so that they will have this department, because these are not in their list of the prescribed department by the NMC. That's all, ma'am.
Absolutely. Let me now go across to Dr. Ishwar Gilada. Sir, we had lost your connection there for a bit. Please go ahead with your thoughts and also help us understand what was the big concern over the earlier order, as the regulatory body had stated that since the generic medications are 30 to 80% cheaper than the branded drugs, this rule would lower the healthcare costs.
See, basically, Riyanka, understand one thing. The baseline is that prior to the pandemic, doctors were considered shaitan. During the pandemic, doctors were Bhagwan. As soon as pandemic is over again, doctor is shaitan. They do not consider us as insan. Number one. Number two, when we talk about cost of medication, if you consider the cost of patented medicine versus generic branded, the cost difference is almost 1% of the patented cost, or sometimes 2% or 3% of patented cost. There is generic and there is generic branded. So like paracetamol can be Crocin, paracetamol can be Dolo. So they are called generic branded. They are not a patented medicine. Secondly, if you suppose write paracetamol, the person will go to a chemist shop. Chemist will give any kind of paracetamol. There are jars of 1,000 paracetamol available in one bottle, and he will give 10 paracetamol from there. So we do not know what is the effectivity of that medicine. Even in medical colleges, government hospitals, where they buy medicine on rate contract, for doctors themselves, their doctors' families and VVIPs, they prescribe medicine from outside. They said, no, we don't trust this medicine. So when we talk about generic, there are always a kind of a margin, which are very thin to understand. Secondly, the Food and Drug Administration Department is called FDA. It is Food and Drug Department. They are not only drug department, and they have a shortage of people. They do not even administer what is happening in the pharmaceutical industry or the chemist shop, and their major time is spent on only food administration. So if they have a lack of infrastructure over there, lack of human resource there, they cannot blame on doctors. Doctors can be told to write generic as well as the brand of the medicine with the slash, so that people understand. For example, suppose I have written only AZT. AZT is a medicine used for HIV. And AZT is called azithromycin.
Right.
And when I have given a prescription of AZT as a generic, they have issued a medicine called azathioprine, which is an immunomodulator drug. So that can be always some kind of issues. And though for running a chemist shop, there is a essential thing that there should be a pharma graduate. But every person at the counter is not a pharma graduate. They are all 10, 12 standards people.
Absolutely.
They do not understand anything. They will give you anything. People will be taking any kind of medicine. So I think NMC which is an offshoot of Medical Council of India, that is supposed to be autonomous, but it's totally autocratic organization. They should not have done this thing. And when they talk about the doctor's update of knowledge, you show me one single instance where NMC has organized a continued medical education program, or they've given us any grant to any organization, or you show us like I talk about HIV. National AIDS Control Organization, NACO, which is a government of India body. In last 20 years, they have not organized one single CME. So who will organize the CME? If you organize, government organize, or NMC organize, or any state medical council organize, there is no need of any association or any pharma companies to do that. So just blaming that pharma companies are supporting doctors, or doctors should not attend pharma company associated CMEs, that is ridiculous. Who will be supporting the CME? There are no foundations in India. Then they just say that CMEs are organized in 5-star hotel. You show us where are the conference halls. And we have also calculated the cost of conference hall with transportation, with food from somewhere, that is going on more expensive than organizing in 4 or 5-star hotel. So we are also very much cost conscious. What you should say that in the pharma or any kind of CME, there should not be alcohol, there should not be smoking, which you have been doing for last
Dr. Gilada, we are running short of time. We'll come back and discuss more on this. Of course, your thoughts are appreciated and respected at this point in time. But as we are running short of time, we have to leave it at that. I would like to thank our panelists, Dr. Ishwar Gilada and Dr. Sanjeev Bagai, and also Dr. Sanjay Kumar Pandey, for taking out their time and giving out their thoughts and discussing this important issue with us here on Mirror Now.